Hi, I'm Marci Milligan. I'm the educational and investment consultant here at Utah Nonprofit Housing Corporation. Many of you may not know, but one of the things I get to do is work with Ginger Tolman here to deliver and create educational programming. Each year we come to you, we survey you, we look for areas of interest, and we try to build off that programming every year to bring you new faces, new information, and the most current information that might help you in your everyday life. Utah Nonprofit Housing Corporation's EdX program stands on 5 pillars. And many of you are already familiar with this, but it talks about digital literacy, financial literacy, access to housing and resources, and well-being. We also try to help you in terms of employment. So no matter your age, no matter your family size, we like to say we bring you programming that can help you directly or help a family member up or down that life skill cycle. Every month, Utah Nonprofit Housing Corporation does a couple of things to deliver this education to you. So we try to say we do 100% to your door. So look for those flyers, look for those attachments that come from your manager. We also are building out a new email database, a phone database to be able to text you. And so if you want to participate fully in that programming, if you would talk to Ginger Tolman, make sure your manager updates your file. Those phone numbers and emails help us get the information to you in another format. On the third Thursday of every month, the Utah Nonprofit EdX program gets delivered to you through Facebook, on the YouTube channel, and also on our website. You can go there and find not only the film itself, but interactive programming, resource links, and other educational items that might be of relevance to you and your family. So many of you ask, is there a fee to participate? And the answer is no. We fundraise those monies and bring those speakers and information to you every month, free of charge. So please don't hesitate in participating. The information's great, and we try to add on it month after month. So many of our residents ask, how can I participate in giving ideas for programming? And what I would want to let you know is that a new survey is coming out. In that survey, we'll be prioritizing what your areas of interest are, and then what you liked or didn't like about the previous year. One of the most important things you can do is to share your telephone number and your email with your manager in your file, because those are new ways that we'll be getting information to you in the coming year. So please participate, and please do share. So every month, we bring you that new speaker. This month, it's Nick Fritz. He's here with us from Intermountain Healthcare today. He is their Director of Impact Investment, and he's going to share a little bit with you about social determinants of health, give you some tips on things you can do for yourself during the COVID-19 era, and things that you can carry forward. They participate with us at Intermountain Healthcare because they believe as we do. Our mission isn't just to provide housing, it's to help improve the quality of life of our residents. So I want to welcome Nick, and I hope you'll enjoy the information he has to share.
Hi, my name is Nick Fritz. I'm the Impact Investing Director in Intermountain Healthcare, and we're very excited to be partnering with Utah Nonprofit Housing Corporation in addressing the social determinants of health. The simplest way to think about the social determinants of health is just the conditions that we all live and work in every day, right? And what we know about those conditions is that they really are the drivers of a lot of our health outcomes. So, kind of the old knowledge is that health is a function of the healthcare that we receive. And actually, that's not really right. We know now that more than 60% of kind of health outcomes are driven by these social, environmental, and behavioral factors, collectively known as the social determinants of health. Yeah, so one example of a social determinant of health is housing. So housing is the thing that Intermountain has focused on in our impact investing work. And really when we're thinking about housing, we're thinking about housing instability, right? So we know that when a person is experiencing housing instability, so they're having to move frequently, or they're experiencing some kind of unhealthy or unsafe housing, that really leads to dramatically poor health outcomes. So in our work in the social determinants of health and with Utah Nonprofit Housing, our hope is to help to improve the affordability, the safety, and really the health of housing. So another key social determinant of health is food insecurity. When we say food insecurity, we not only mean having enough to eat, but having high quality and fresh food to eat. And this stands to reason, right? I mean, we've known for a long time that kind of the nutrition that we have is a driver of health outcomes. Now we think about it in terms of place, though. So there are these things called food deserts. And a food desert is an area that does not have access to fresh food kind of in close proximity to somebody's home. And we also know that people who live in food deserts tend to have poorer health outcomes than their peers who might not. So food really is a key driver of health and something that we hope to address through the impact investing work. Turns out there's actually 9 social determinants of health, the way that we think about them. Another one that I think is worth talking about is transportation. Now this one is less obvious than food security or housing maybe, right? But we know that when somebody lacks access to transportation or they're spending an outsized amount of their income on transportation, that actually has an impact on health. And it comes through either not being able to get to kind of key resources, or you're kind of spending such a high portion of income on transportation that it comes at the cost of buying fresh food or making other choices that might kind of more directly impact health. One more key social determinant of health is just access to healthcare, right? So not the actual healthcare that you're receiving or the quality of it, but just being able to go to your primary care provider or to any other provider that you might need to see to be able to receive treatment. And part of that access to care also is being able to be proactive about your health. So instead of kind of reacting to negative things that are happening, taking kind of preventative measures. And we have more resources to kind of talk about and explore some of what those proactive measures might be. Intermountainhealthcare.org is a really great resource for those. In particular, the community health page. So intermountainhealthcare.org/community health has a lot of examples of what some of our initiatives are, and also talks a lot about kind of health behaviors and other things that will help you to build health. I realize that many of you may not be Intermountain Healthcare or Select Health clients, but important to go to your provider's pages, similar to the ones that I just described. They'll all have kind of a similar resources and information page to really take a proactive step in health. So this partnership between Intermountain Healthcare and Utah Nonprofit Housing Corporation is pretty young, but one of the things that I'm looking forward to being able to bring back to you and sharing is the results of a small kind of pilot survey that we're doing with a few of your residents that will really help to put a bow on the link between housing and health within our partnership. And the results of that survey will really drive how we choose to build the partnership over time, and we're looking forward to that. So the survey that we're rolling out, the intent of it is really just to draw a strong connection between housing and health. So we're thinking about things like kind of general well-being, feelings of security, and whether health is improving over time. Using this information, what we'll be able to do is kind of tailor programming in the future and tailor how we seek to address the social determinants of health. So thank you in advance for your participation in the survey, because the results will really help us to serve better. Remember,
Wear a mask,
wash your hands,
socially distance, and be
be
well.